They are supposed to fluctuate, but there is a certain range. And with blood glucose, they should not be severe highs and severe lows. That is not good because it increases your inflammation and oxidative stress. Both of them are bad. So this is the reason I don't favor hemoglobin A1c as a measure of blood glucose levels. So here you can see all these three patients have a hemoglobin A1c. So hemoglobin A1c is a measure of average blood glucose levels for the last 3 months. Now you can see here that all of them have 7, but this person has had time in range, though it is 180 milligram, 100% of the time, versus this person had very high blood glucose levels 29% of the time and very low. So hypoglycemia, these were people with diabetes. Hypoglycemia is also not a good thing for people with diabetes, definitely. This person had, only 63% of the time was time in range, whereas this person this was like hypoglycemia was much more. But all three of them had the same hemoglobin A1c. And some people with, iron deficiency, B12 deficiencies, hemoglobin A1c doesn't represent the correct number. Even among South Asians, hemoglobin A1c is not the best measure, but it's easy to do. You don't have to be in the fasted state. However, it is not the best measure for blood glucose, and you can see here. So when you're planning life is like a marathon, not a 100-meter sprint. When you're planning a marathon, you'll have to take the long view. So looking at only hemoglobin A1c and being happy that it is, your doctor would say it's normal and optimal, I would, I would disagree with normal. We look at 5 or less as better than 7 or 6. Hemoglobin A1c is not the best measure for blood glucose levels. So this is important to keep in mind.